Yeah, get him over here. We're going to keep him from making fun of us. The sagittal, I'm sorry, coronal suture, sagittal suture, lambdoidal suture.
What is that?
No. Cranial bones, frontal bone, nasal bones, maxillary,
Sorry.
lacrimals,
Oh, how do you zoom in? Can you zoom in?
zygomatic, mandible, parietal, occipital, temporal. On the temporal bone, the mastoid, the styloid,
No, not really.
the mandibular fossa. On the mandible, the mandibular
I need to zoom
condyle.
in.
On the underside, the palatine bone versus the palatine process, and the vomer, the vomer.
It's not bad though. I mean, kind of.
Got the vomer? Got the vomer? Vomer? Do it in 3D.
Professor. Where's the bone?
The vomer is like the little, yeah.
Oh, we forgot. Where's the ethmoid? In there.
Right,
In the
like,
nasal
right there,
cavity.
yeah.
And
Okay.
there's the ethmoid.
So you, I put it to you too.
Around the corner, 2. Yes, where's the atlas found in a plastic bag? The atlas, we all know what the atlas looks like. We know what an axis looks like. So I'll probably be taking these out next week. On a typical lumbar vertebra, the body, the pedicles, the transverse processes or TPs, the
We're like looking at the back of your hand.
the lamina,
I can't see it this way.
lamina, and the spinous. Okay?
Do you do it here?
Body, pedicles, TPs, lamina, and the spinous. Okay? You got that?
Don't go nuts.
At the
I
bottom,
know.
how about you pass the sacrum this way?
Oh Lord.
On the sacrum,
This is going YouTube.
sacral
This
base,
is
base, ala, sacral canal,
Is the audio
I'm,
out?
oh, I see it now. And the opening at the bottom, the sacral hiatus,
It's nothing about the audio.
hiatus, 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 hiatus. Yeah, could you like all go around to the other side?
No, this is fine actually.
Do you know when the president's talking, there's not somebody behind him. Oh, Mr. President, could you turn around and say that again, please? All right. I know. When you become president, we'll stand in front of you too. On the sternum, the manubrium, the body, and the xiphoid. Okay, pass the scapula. On the scapula, spinous scapula, acromion, coracoid, and then the glenoid. On the humerus, the head, the greater and lesser tubercle, and on the distal end, the coronoid fossa, the olecranon fossa.
What? That's the hole your thumb fits in, isn't it? Right?
Yeah, the one your thumb fits into.
Olecranon, right.
And then we've got the round capitulum, and then the trochlear. Radius and ulnar. Radius. Head of the radius, and the styloid of radius. On the ulnar, the olecranon or olecranon process, the trochlear notch, and then the coronoid process. And then the distal end is actually the head. It's the only bone where it's reversed, the head with the styloid. And on the hand, we just need to know these are called carpals, These are called metacarpals, and these are known as
Phalanges.
phalanges. And we go for the iliac bone. The ilium, the ischium, and the pubic bone, or pubis. The acetabulum,
Thank you.
the obturator foramen,
Okay. No, thank
and I just put a dead guy's bone on my face.
you. Yeah, that's okay. You too, y'all. You're calling
Oh, that is so gross.
OT.
The ASIS and the PSIS, and the greater sciatic notch. And the femur, the head of the femur, the neck of the femur, greater and lesser trochanters, the linea aspera, the popliteal fossa, and then the medial and lateral condyles. That would be where the patellar sits. On the tibia and the fibula. Yeah, it's kind of tricky to know which end is up on this guy, but on the tibia, the tibial tuberosity and the medial malleolus, and then it would simply be a written question, what's the distal end of this bone called? The distal end is the lateral malleolus, the proximal end is the head. And who's taking up the rear? The clavicle, with the acromial end and the sternal end. And lastly, on the foot, the talus, the calcaneus, and then metatarsals and phalanges. And that's, and
It's gonna be YouTube, yeah.
we're gonna put me on YouTube.
Yeah, if you don't mind.
Oh, yeah.
The question is,
Professor,
what's
one
the-
more thing. Oh, yeah. We got it.
What was the question? What
The
the
question,
Stop
the question
recording.
was,